A study that's getting a lot of attention. It's from the Academy of Nutrition and Dietetics, and it says people of color make up less than 13% of registered dietitians in the U.S.
And when you look at the number of just African-American dietitians, that number is less than 3%. Kimberly Gill's been looking into this with a look at how a lack of diversity in dietetics can impact health outcomes in communities of color. Makes sense.
Yeah, guys, good evening. And when you hear those numbers, you might be thinking to yourself, why does it?
Oranges are good because they're high in vitamin C.
Detroit native Kimberly Snodgrass has been a dietitian for 20 years.
You kind of prove that you know what you're talking about, and sometimes you have to do that. You shouldn't have to. And so I always felt like I need to represent wherever I went. I need to make sure that I knew what I was talking about, that I was on my A game, and it just made me a stronger person.
As one of only a handful of black dietitians in the country, Kimberly chose the profession thanks to her mother's experience with one.
My mother's a nurse, and she worked with an African-American dietitian. And she saw something in her that she sees in me. So you love food, you love nutrition, just following mom's advice. And I never looked back, and I'm glad that I followed it because I'm one of very few in the profession.
Getting ahead in the profession, she says, has been a challenge.
My experiences 95% of the time have been very good, but there have been barriers. We all, black and brown people, we have racism, discrimination, those things that we experience, and I've experienced those. I haven't been able to climb the ladder, if you will, in my profession, because most of the times when I go for interviews, people that interview you don't look like you. The group of people that are being interviewed don't look like you. And so you're one of very few.
And what does that mean for patients? When the system lacks cultural competence, or in other words, people that don't look like you might believe health is not attainable.
If you go in and you seek counsel for someone who doesn't look like you, they don't know how you eat. They don't know where you shop. Typically, you have to tailor the recipe. So for the collard greens, instead of using, I think, a lot of salt, we definitely try to use more herbs and spices. So more garlic powder, more onion powder, instead of ham hocks, maybe like, smoked turkey, so kind of switch it up a little bit, or a liquid smoke. So we could take what your grandma had and make the recipe a little bit healthier, a little less lower in salt and cholesterol and fat, and still be flavorful.
In order to diversify the field, Kimberly says a lot needs to be done to make nutrition education accessible. She says the biggest barrier is money.
Unpaid internship. So typically when you go to college and you graduate, you want to start a job to pay off your student loans if you have those. Where you can't do that. You have to pay for an internship. It can cost thousands of dollars. And most people of color may not have that financial stability to do so. Then now they're requiring that you go for your master's, where that's going to be something that's new.
One bright spot, more scholarships are being offered to minorities, which Kimberly is a recipient. She's currently working on a master's degree in public health.
But I feel like in order to climb that ladder, going back for my master's will help a lot. The racism and discrimination, that's nothing that I can do anything about. But I can go back to educate myself and keep trying. I believe that if God opens a door for you, it's for you.
That's right. And what we saw during the height of the COVID-19 pandemic is a prime example of how areas such as Detroit, with food deserts, residents without health insurance, and lower education levels, made our folks more vulnerable to the disease. And food is a big part of that. It contributes to our mortality rate. So educating people about how to eat without making them feel like all their food is undesirable and needs to be cut out completely is huge. And cultural competence is a big part of that.
So much to this, that access to healthier food is just massive. It's everything.
Really
and also help for people to get the right education, to get the degrees, to get in this job in the first place.
All of that is
so
intertwined.
much.
Yeah, exactly.
Yeah.